Hi everyone, my name is Robertson. I'll be doing a presentation on cybersecurity policy and executive summary to the CEO of Augusta Medical Hospital. Cybersecurity is a strategic enabler of patient safety, regulatory compliance, and organizational resilience. The process of creation and or changes to different types of standard in Augusta Medical Hospital need to follow a governance-driven standard in its life cycle to ensure compliance. This is done by drafting information security with clinical input, legal compliance, and privacy validation. The NIST cybersecurity framework has five core functions, which are to identify, protect, dictate, respond, and recover of comprehensive security. The standard in this case is HIPAA, which needs to be in strong regulatory compliance. Also, electronic health information needs to be protected to ensure patient trust. Cybersecurity lifecycle in Augusta Medical Hospital needs to be applied continuously by one, the risk assessment and asset. They need to be risk assessment and asset classification, so much such that all items or all items in the hospital need to be classified. Policy, the next is policy and control implementation. Who needs to access what and what type of policy does those that have access to needs to be in compliance with. For instance, if you do not have a badge, you can't go past this point. If you do not have a card reader, you can't access some electronic devices. The next aspect is constant monitoring and dictation. It is very important to constantly monitor any, especially the network, so that it will be easier for analysts to dictate what anything once something is going wrong. Early dictation is key because it can be prevented easily. Uh, the next is incident response and recovery. As I said earlier, if the system is monitored constantly, it will be easier for them to dictate any incident and they will respond to it as swiftly as possible, as well as they will recover any damage or they'll prevent damages from happening. When all this is done, there needs to be there needs to be a lesson learned from possible improvement. Security policies and business alignment. We all know the hospital is also says the hospital is there to treat patients as well as it is also there for business purposes. So they need to have specific objective to ensure business continuity by protecting. This is done by protecting patient confidentiality and safety, ensure compliance with healthcare regulation so that they shouldn't get fined from time to time. Uh, the next is meaning and available of clinical system. There should be a good system, a good framework that everything functions well and effectively, supporting trust among patient and partners. Cybersecurity threat and business is a business enabler and not a barrier, in as much as the hospital is there to protect, to make sure cybersecurity is respected and followed. It shouldn't be a barrier for patients or other users to feel. Uh, it shouldn't be a barrier for patients and other users. The system and network overview in the hospital environment include electronic health record, medical and other devices, segmented clinical and administrative network, secure cloud devices and encrypted backups, risk assessment to ensure business continuity. This is done by organization needs to conduct regular assessment, identify any problem that is going on within the hospital, especially if there is any cyber threat to clinical operations. They should figure out a way to prevent that. Impact on patient care and revenues, recovery time, this all this to ensure that patients should be treated without any disruption. Cybersecurity governance and standard, legal regulations, the laws which are put in place. Example like HIPAA, internal policy, which are put in place to handle patient information to make sure patient safety is taken care of. Global standard and framework. This is to ensure that uh, the framework which are put in place needs to be followed effectively, like the NIST cybersecurity framework. Effective incident response, how the hospital is planning or how the hospital has planned to respond in case there is an incident. First, they need to dictate and analyze, and this is done by constant monitoring. They need to contain and they need to come out with a way to recover in case there are any damages, and post-incident review what they learned from the incident. Incident response and incident handling. Uh, by doing this, the hospital need to be prepared. For instance, employing uh, people with who have the technical skills to handle this. They need to contain and eradicate. They need to recover the system in case there is any extortion. Post post incident review. The hospital needs to promote a culture of security through social engineering awareness, secure use of mobile phones and Internet of Things devices, data protection. Now, Augusta Medical Hospital needs to protect its patient safety and trust, enable enable regulatory and compliance, support strategic growth and initiative, and require ongoing executive leadership and oversight. Strong governance ensure long-term resilience and also favors business continuity. Thank you.